Habibi, what if I told you that one of the most common causes of premature ejaculation is something many men were born with and not a lack of self-control? Stay with me. See, let's talk about the truths nobody told most men about premature ejaculation. To you who has been living with this in silence, maybe for months or years, I want you to hear this clearly. See, premature ejaculation has a name, recognized causes, and most importantly, it has treatment that works. You see, in many cases, the biggest obstacle between you and effective treatment is one honest conversation with your doctor. Today, we will discuss what premature ejaculation is, why it happens, and what actually works. I want you to make sure you stay to the end of the video because I've got a gift for you. And before we begin, do not forget to subscribe to this channel and turn on your notifications so you never miss my new videos every week. All right, so let's get into it. See, a study revealed that in a room of 10 men, approximately 2 to 3 are likely to be living with premature ejaculation. And that makes it one of the most common male sexual concern worldwide. So first, let's clear up an important misconception. See, premature ejaculation is not the same as erectile dysfunction. Premature ejaculation, or PE like we mostly call it, refers to ejaculation that consistently occurs sooner than desire, often within 1 minute of penetration, and then causes distress, frustration, or difficulty in a relationship. That last part is the most important, meaning if a man ejaculates quickly but is not distressed by it and did not create relationship difficulties, treatment may not be necessary. See, erectile dysfunction, on the other hand, is the inability to achieve or to maintain an erection sufficient for satisfactory sexual activity. The two conditions are different, although they can sometimes occur together. I would like you to understand that premature ejaculation generally exists in two forms. There is the lifelong premature ejaculation, and that means that it's been present from the man's earliest sexual experience, and it tends to occur consistently across different partners and situations. And then we have the second form of it, and that's the acquired premature ejaculation. This develops after a period of normal sexual function when a man who previously had good control begins to experience difficulty delaying ejaculation. Today, let's look at the 3 most important causes of premature ejaculation that many men have never heard about. The number 1 factor here is the neurobiological factors. And this explains that men are not biologically wired the same way. Researchers suggest that some men with lifelong premature ejaculation have inherited differences in their brain pathway that regulates ejaculation. You see, the key player here is the neurotransmitter in your brain that is known as serotonin. Your serotonin is involved in mood, impulse control, and sexual function. Now, here is a catch in this video. See, the higher the serotonin activity, the tendency for you to be able to delay ejaculation. Meaning, the lower the serotonin activity, then the more rapid you are likely to ejaculate. Do you see it now? The second point I want us to consider is the psychological factor. And here, performance anxiety is the number 1 and the most powerful driver for acquired premature ejaculation. You see, when a man becomes anxious during sex, the body's stress response system becomes activated automatically. And what this does is that it increases your physiological arousal, which accelerates ejaculation time. The irony is that the more you worry about ejaculating too quickly, often increases the likelihood of you ejaculating quickly. Do you get it now? So let's move to the number 3 point, which is the medical causes. You see, many men are surprised to learn that certain medical condition can actually contribute to premature ejaculation. And one example of this is prostatitis, and that's the inflammation of the prostate gland. So if premature ejaculation develops after years of you having normal sexual function and is accompanied with symptoms like this: pelvic discomfort, pain during urination, pain after ejaculation, your prostate should be examined by your doctor. There is another commonly overlooked causes, and that is hyperthyroidism. Hyperthyroidism is when there is overactive function of that small butterfly-shaped gland on your neck that we call the thyroid gland. Because the thyroid influences many bodily functions. So when there is increase in the activity of your thyroid, this can also accelerate your ejaculatory reflex. So treating the underlying thyroid disorder often improves that symptoms. And this is why men who develop premature ejaculation later in life should consider a proper medical evaluation rather than just assume that this problem is purely physiological. You see, a basic assessment that you will need includes hormonal testing, your thyroid function test, of course, and evaluation of your prostate by your doctor would also be appropriate. Now, let's discuss about the treatment. See, the encouraging news is that premature ejaculation is highly treatable compared to what many had believed. We have the behavioral technique, which is one of the oldest evidence-based approach, right? And that uses the stop and start technique. Let me explain. This involves you stimulating just when you're about to ejaculate, you pause and then you let the urge subside before resuming. Now, when I say pause doesn't mean stop. It means you move from penetration to foreplay. Over time, what this does is that it helps to train your nervous system to tolerate higher level of arousal. Another similar approach is the squeeze technique. I'm sure some men are familiar with this. What this involves is that you apply pressure on the head of the penis at the point just before ejaculation. And what this does is that it reduces arousal and it helps in delaying climax. You see, these two methods actually require two things, and that's patience and consistency, because the solution does not happen overnight. Actually, I go as far as encouraging my patients to do the stop and start technique with their urine. So what it means is that when they are urinating, you stop, you continue, you stop, you continue, you stop, because this will help improve your nervous system. All right, so let's talk about the medical treatment. For the medical treatment, there is the topical anesthetic spray, right, that contains lidocaine that you can spray on the penile to reduce penile sensitivity and help to delay ejaculation. But please understand and remember that you should apply this 30 minutes before intercourse, because if you do 5 to 10 minutes before, it can also numb the private area for the woman and kill the sex fun that you're about to have. Also, there is an antidepressant that is commonly used for premature ejaculation treatment. But there's something about this medication. Unlike other antidepressants that are taken daily, this medication is often taken few hours before sexual activity. What it does is that it increases your serotonin activity in your brain, thereby improving your control of ejaculation. So in addition to your treatment, your doctor may recommend supplements like the L-arginine. You've got the zinc, we have magnesium, vitamin B, and vitamin D, etc. Many more. Your doctor might give you all of these. What they do is simply to improve the blood flow to your penile, to help you balance your hormone, to improve your nerve function and stress regulation. You see, for many patients, the best results are often achieved through a combination of approaches, meaning that you have to combine the behavioral with the medical before you actually get your desired or better outcome. If there is one message I want you to take away from today's discussion, is that premature ejaculation is not a personal or permanent failure. It is a medical condition with recognized causes and effective treatment. So, brother, you do not have to struggle with this in silence if it is affecting your confidence, your relationship, or the quality of your sexual life. I want you to speak with a doctor today. And to everyone who has stayed with me up until this point, I want to say thank you. And to those who are going to share this episode with someone who needs it, thank you so much as well. That simple act of sharing may encourage someone to seek help and to improve the quality of their sexual health. To join my community and stay updated on Dr. K's and Cliniconlineplus, click on the link in the description below this video. And if you're not a subscriber, please hit the subscribe button and turn on your notifications so that you do not miss my next episode. See you again next week. I love you. Thank you. Ireo.